The morgues in Arizona's largest county are nearly filled with coronavirus victims, and 600 healthcare workers from across the country are coming in to help Arizona's overwhelmed hospitals. Here's what one nurse told NBC News.
But the patients here are just as much sick as the ones that I saw in New York. Just the other day, we had 3 patients to pass, probably within 10 minutes of each other. That's how quickly things can turn. The majority of the patients are on ventilators due to being positive for COVID. So the numbers, I think, are definitely rising. We see that every day. The majority of these patients are also on dialysis, so they have to have that for their kidneys to function. They're very, very sick just from it affects the whole body system. And I think that's one thing that people don't understand, especially if you're looking at somebody that has it but is not symptomatic. It's kind of hard, I think, for you to grasp how sick these patients really are. And I felt like my experience in New York would help me deal better with what was going on here, and just hopefully that not only dealing with the patients and family, but dealing with the staff, sharing with them what I had seen. I was talking to some of the staff yesterday, and they said that they really appreciate us coming because they were working 10, 13, 12-hour shifts in a row. They're tired. Some of them have gotten sick. They don't have enough staff. So that's where we come in and try to help and work right beside them, partner to partner. So without having this ability to come in, they would be suffering. They're human too. I'm human too.
NBC News reporter Vaughn Hillyard joining me now from Phoenix. And Vaughn, some of these traveling nurses were in New York City during its coronavirus peak. God bless them for the work that they're doing. Tell us more about why they're coming to Phoenix.
I'm glad you just played part of that interview with Patsy Sykes. She's from Montgomery, Alabama. She spent 2 months up in New York City and is now here in her 3rd week in Arizona. And you heard her say that. They're human, and I'm human too. And I think that's where this comes down to. We're talking about more than numbers. I can tell you that more than 150 Arizonans have passed away in the state of Arizona over the last 48 hours. We can also introduce you to people like Patsy and another gentleman who I want to introduce you to now, Allison, Shannon Sims. You're actually from Arizona here. In this spring, you went and spent the month of May and June in New York City, in Brooklyn yourself. You're an ICU nurse, deep background in critical care. Shannon, can you tell us what you saw first up in New York City those 2 months that you were there?
I saw that they had a very different approach to isolating themselves to try and quarantine themselves from this virus. For example, you didn't see people out and about. Those streets were very desolate. There was not very much going on at all. No one you saw walking around, kids at playgrounds, at parks, things like that. You didn't see people outside having barbecues or anything like that. That's one of the largest contrasting things that I see coming back home is people are still unsure of what it really means to quarantine. In the hospital setting, I'm still seeing people who are very choosy of when to wear the mask. If we know that a patient is positive, then we wear a mask.
What do you want folks out here to understand about how many folks did you see even pass away in New York?
Back in New York, at least triple digits, absolutely. Coming home, as you mentioned, I've only been here a short period of time. I just got wind yesterday that a good friend of mine and co-worker, we worked together since 2013. He just passed away with COVID-19. One of my good friends and also co-worker is hopefully going to discharge from the hospital today, and she's been positive with COVID-19. And these are local people. This isn't my exposure and experience in New York City. So it's very concerning.
When you talk about staffing, you saw what happened in New York, and you're seeing here, there's more nurses that are going to be coming here into Arizona to help alleviate these pressures. What is that experience like in terms of, as you know, the nurse we interviewed earlier said, we're human too. What is that like being in these facilities right now?
To be honest, I don't have anything negative to say about any of the facilities. They're all working very diligently and as quickly as they can to try and get this thing right. This is not like anything we've seen before, right? We don't have a manual or a playbook. But what we can do is utilize the experiences and the exposures of those who have experienced the brunt of this and continue to build that playbook. And what I'd like to see people do in our community is focus on protecting one another by trying to wash your hands, wearing these masks, and socially distancing. That means not allowing your kids to go to parties, not setting up parties, not going to the lake, not going to camping grounds because you're still coming in contact with others. And to be quite frank, you cannot assume that everyone is doing what you're doing.
Shannon, thank you so much, and God bless you, and thank you for your work. And, you know, we were talking, today's your first day off in more than a week, and you came and joined us out here in the 110-degree heat. I should put into context, you know, you said this is our home. It's my home, too. And things become a lot more real, Allison, when you start to really understand the spread of the impact in one's own community. And that is, Shannon, you gave 2 months of yourself in New York City, and now this is back home here for you. Thank you for your work and your efforts here.
Thank you.
Allison, I want to put into context, we're standing here in front of the Maricopa County Medical Examiner's Office, and we're talking about the number of dead folks here in the state. That number continues to rise, and they have brought in, we should note, in just the last 24 hours, 4 backup refrigerators to be used potentially as morgues as the death toll continues to increase here, Allison.
Vaughn, it's just an unbelievable situation there. And I know he can't hear us. If you could thank Shannon for all of us here in New York who are so grateful for the people who came here to save lives and to help protect our city. You're going to make me cry on TV. I've been doing that a lot lately. I usually don't, but we are so very thankful. It's people like him who helped us get better. Thank you so much.
Mm-hmm. Thanks, Allison. We'll pass it along.
10% of the COVID-19 tests in Georgia are coming back positive, but the governor won't allow mask mandates in the state. NBC News correspondent Blaine Alexander joining me now from Atlanta. And Blaine, in this executive order, the governor banned local localities from mandating masks. Why is that?
Yeah, so this is really in line with what the governor has been saying all along during this pandemic, Allison, which is he does not want local leaders enforcing policies that are more restrictive than what he's put in place statewide. So he said this. He said that he doesn't believe it's enforceable. But what he does in this kind of 40-page executive order, there's a portion in there where he says and puts into writing for the first time that local leaders cannot require people to wear masks or face coverings. So what this really does here in Georgia, though, is that it intensifies this kind of battle that we've seen all along between Governor Kemp and some local leaders. We've seen this now for the better part of this pandemic. And what you're seeing now from those leaders who had already put it in place, places like right here in Atlanta, like Savannah, like, Augusta, big cities like that, is you're seeing defiance. You know, in the past hour or so, we heard from Atlanta Mayor Keisha Lance Bottoms. Her office told me today that their order is going to remain in place. And they say they're going to continue using data and science to drive how the city moves forward and makes its decisions. In fact, the mayor said that she's not at all concerned about the state possibly suing the city over this, saying that she would put her policies up against any others any day of the week. So certainly a lot of back and forth, a lot of discord over this, what came out from the governor yesterday.
Blaine, I know you've spoken with the mayor of Savannah as well. How is this order impacting that city? What are you hearing about what Savannah plans to do to deal with this?
Well, the response is defiant. You know, he spoke on MSNBC earlier this morning, but he also put out a very strong tweet, one of the strongest responses that I've seen to this, essentially saying, you know what, we now know what the decision is, quote, Governor Kemp does not give a damn about us, essentially. So let's play a little bit of what the Savannah mayor had to say about this. Take a look.
I have been absolutely flabbergasted by what has occurred here. In a situation where the state of Florida is the hot spot of the nation and Alabama has mandated masks, our governor will not only roll it back, but then also try to forbid cities in being able to carry out the mask mandates as we have already declared them. On one end, we're fighting COVID. On the other hand, we're fighting our governor. Our hands should be totally and unequivocally working to fight this virus.
Now, Allison, I think it really bears mentioning here that Governor Kemp is not saying that masks should not be worn. In fact, he is encouraging them to be worn. That was part of the order that was issued yesterday, saying that they're encouraging people to wear masks. He was wearing a mask when he greeted President Trump on the tarmac at Atlanta's Hartsfield-Jackson Airport yesterday. And he's even kind of embarked upon this sort of statewide tour, going from city to city, wearing masks, posting selfies to his social media account, saying things like "Mask Up Georgia." So he's encouraging people to wear masks. But when it comes to that enforcement, to that requirement, that's where he's stopping short. That's where he says that goes a step too far. And he said that in the past, that he does not believe it's enforceable. Allison.
Blaine, as we're talking here about masks, what is the ICU situation in Georgia? How are hospitals in the state doing?
Well, hospital numbers are going up. Hospitalizations are going up. You know, we've seen really kind of some of the highest numbers that we've seen since back in April or so. And that's something that Atlanta Mayor Keisha Lance Bottoms addressed today in her news conference. She said that one of the reasons why she is requiring masks in the city of Atlanta is, in her words, she's hearing from people inside of these hospitals. And she's saying that they're telling her that they're overrun, that they're concerned about capacity, they're concerned about space, they're concerned about being able to treat people. So she says that she is requiring masks in part because of what she's hearing from the hospitals. Allison.
All right, Blaine Alexander in Atlanta, thank you so much. 156 people have died in Florida in the past 24 hours. That is a state record for the highest increase in coronavirus-related deaths. Hospitalizations there hitting records, too. Meanwhile, schools in the state are getting ready to reopen in just a few weeks. NBC News correspondent Kerry Sanders has the latest from Miami Beach.
Well, Allison, again today, the numbers are going in the wrong direction. The number of people coming back with positive tests in Florida hitting 13,837. That follows, if you look at the numbers, a little bit of a dip, but we went from 15,000 to 12,000 to 9,000 to 10,000 and then back up to 13,000. And so clearly the coronavirus spread continues. Now, one of the underlying recognitions in these numbers is really quite disturbing, especially as people are talking about sending their kids back to school. And that is some analysis by the Department of Health in Palm Beach County, where they've looked at the state numbers, and pretty close to 1 in 3 kids tested, that's under the age of 18, is coming back with a positive test. And why that is most concerning, as kids are talking about with their parents going back to school, is that even if we have very few serious results from exposure to coronavirus for young kids, in fact, in the state so far, only 4 people have died, horrible for the families, but statistically a very low number of people 18 and under who have died from coronavirus in this state. But remember, those kids go to school, and then they come home and they see their adult parents, their grandparents, their aunts and uncles. So a real concern about how, if these numbers bear out or get even worse, how you'll be able to open schools without getting coronavirus under control. Allison?
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.